Dear students, yesterday we discussed about sexual transmitted infections, so-called gonorrhea. Gonorrhea have most effective ways to be prevented their spread by having be faithful to your sexual partner. Use male or female condom. If you think you are infected, avoid any sexual contact and visit health center. If you are infected, inform all your sexual contacts immediately so that they can be examined and treated. If you are infected, do not have sex until you finish your course of treatment. Those are the most effective way of preventing method. This is one of we have discussed yesterday. And today of term 3 of week 4 lesson 2, we are going to discuss about the remaining or the second type of sexual transmitted infection, so-called syphilis. So objective of the lesson: after completing this lesson, the students will be able to describe the effects of sexual transmitted disease, so-called syphilis, list the transmission, symptom, and the prevention way of syphilis. Let's go on. Syphilis is caused by spiral-shaped bacteria. By the way, bacteria are different shape: root-shaped, spherical-shaped, spiral-shaped, flat-shaped, and so on. So this type of disease of sexually transmitted infection known as syphilis is spiral-shaped bacteria, which is causative agent called Treponema pallidum. Treponema pallidum is the main causative agent. This syphilis is spread by sexual contact, since they are sexually transmitted infection, with someone infected. In addition, congenital syphilis is spread from mother to fetus. However, syphilis cannot be spread by contact with toilet seat, baths, shared clothes, or doorknobs. If a pregnant woman has untreated syphilis, it may result in death or deformity of the child. In many places around the world, pregnant women are tested for syphilis because if the infection is discovered and treated, any problem for the unborn child can be completely prevented. So this type of diseases are more likely to infect sexually active person, which means they can infect people between the ages of 15 up to 30 because this group of people are very sexually active. The symptoms: syphilis progress in distinct stage. It can be treated in the early stage but not in the late stage. So once it goes to the late stage, it is difficult to treat. So you have a power to treat at the early stage. The symptoms occur in the stages called primary, secondary, and tertiary. Let's see one by one. The primary symptoms of syphilis are usually sore or sores which are painless and appear at the site of the initial contact. They are commonly found on the penis, on the entrance to the vagina, and the mouth, in the rectum, or inside the vagina itself, where they are invisible. This stage may be accompanied by a swollen gland, which usually develop within a week after the appearance of the initial sore. The sores may last from 1 to 5 weeks and may disappear by themselves even if no treatment is received. Those sores are very infectious. The secondary stage of the disease appears approximately 6 weeks after the sores first appear. The most common symptom of this stage is a rash on your body. Other symptoms can include tiredness, sore throat, fever, headache, hoarseness, loss of appetite, patchy hair loss, and swollen glands. These signs and the symptoms will last from 2 to 6 weeks and generally disappear, even without adequate treatment. Symptoms are not noticed, or if they are noticed, people tend to be mistake them for other minor illness such as heat rash, cold or flu, or influenza. As a result, they do not visit doctor and the disease is not diagnosed. If the disease is left untreated, it goes into a long quiet phase where there is no obvious symptom or asymptomatic, although the bacteria are still active in the body. The last stage of this disease, known as syphilis, is tertiary stage. The syphilis of over 4-year duration It may involve illness in the skin, bone, central nervous system, and heart. It causes severe and irreversible problems that cannot be treated successfully. The control and prevention of this type of disease is mainly syphilis are controlled and prevented by having antibiotics, by taking antibiotics like penicillin or tetracycline is the main antibiotic used to treat syphilis, by having faithfulness, by using condom, avoiding sexual contact until getting medical treatment, do not have sex until your treatment is completed. Those are the main control and prevention way of syphilis. Because it is caused by bacteria, it can be treated by using drug, penicillin and tetracycline. So the amount of treatment depends on the stage of syphilis. So the treatment using antibiotics depends upon the stage of syphilis, which is primary, secondary, and tertiary. According to the stage, the antibiotics were given. In the tertiary stage, the damage already done on the tissue and the organs that cannot be undone. Dear students, this is all about sexually transmitted infection, so-called syphilis. So thank you for your attentive following up. See you, stay safe.